Hi, my name is Sergeant Wang. Today I'm going to present my case study on emphysema. Terminal learning objective: given 5 elements of nursing care process and a patient who has severe emphysema, determine for patient care. Enabling learning objectives: A. Introduction of patient's information. B. Describe the etiology, pathophysiology, clinical manifestation, assessment, diagnosis, medical management, and nursing interventions of emphysema. C. Discuss the discharge consideration and the prognosis of client. A little bit about our client. His name is C.E. He is a 70-year-old married man, and he's a retired railroad engineer. He came to us because he complained of out of breath whenever he tries to do anything, and he has a resting O2 set at 83%. He was sent to the local hospital for chest x-ray and ABGs and was diagnosed with severe emphysema. The physician told him that he must start on continuous oxygen therapy, and there is no known smoking history, but his condition could be caused by occupational exposure because his job was a railroad engineer, and his wife died 4 weeks later. Emphysema is one of the 2 disorders under COPD, the other one being bronchitis. This is a permanent enlargement of air spaces and destruction of alveolar walls. Emphysema is caused by chronic irritation such as cigarette smoking or air pollutants, and such irritants causes that bronchi, bronchioles, and alveoli to be inflamed, and the narrowing of the lumen causes air trap during exhalation. Because of the loss of elasticity, when the patient exhale, the lumen won't be able to get rid of that CO2, and that will cause hypoxia and hypercapnia. That means patient's O2 will also be very low. And this can also be a rare genetic disorder, which is a deficiency of alpha-1 antitrypsin. This is only constitute of 1% of all the emphysema cases. Some clinical manifestations: dyspnea will be the number 1 manifestation, and it will also worsen over time. And we can usually see the barrel chest appearance in our emphysema patients because of overinflation and the use of accessory muscles for breathing, because they have hard time breathing all the time. And we can also see spontaneous pursed lip breathing, and the patient will sometimes assume a tripod position to expand their lung capacity. And we can also see weight loss in this patient because they consume a lot of energy on just breathing and not so much on eating. So some assessments. The subjective assessment we can do is to ask patients for the history of dyspnea, coughing, or sputum production. Also history of smoking, smoking cigarettes, or exposure to inhalants. And we should also ask them for the family history of respiratory disorders, since that 1% of the rare genetic disorders. And the objective assessment we can do is to look for any tachycardia, tachypnea, orthopnea, peripheral cyanosis, and the clubbing of fingernails. That will be an indication of poor extremity perfusion, and also that barrel-chested appearance. Some diagnostic tests: we can do PFTs to see their lung capacity, ABGs to see that partial O2 and CO2, and chest x-ray to see again that barrel chest. For medical management, emphysema patients they need long-term home oxygen therapy, and chest physiotherapy as needed. For medications, they are usually bronchodilators are ordered, also anticholinergics, corticosteroids for acute exacerbation, antibiotics because these patients are usually at high risk of pulmonary infections related to retained secretions, and we can also order them diuretics for fluid removal because with this patient they usually have right heart failure, and that will cause edema. Also, they can manage their condition by pulmonary rehab and also aerobic exercise such as walking to increase the lung capacity. So I'm going to go over some drugs. First up, we are gonna talk about albuterol. This is a short-acting beta adrenergic antagonist. And indication of this drug is to prevent bronchospasm in patients with obstructive airway. And this drug binds to beta-2 adrenergic receptors in bronchial smooth muscles and causing smooth muscle relaxation. Side effects will be insomnia, restlessness, anorexia, cardiac stimulation, hyperglycemia, tremor, and vascular headache. Some nursing implications will be to observe for paradoxical bronchospasm, which is wheezing. If occurs, we should withhold the medication and notify the healthcare provider immediately. And this drug is to be given 2 puffs every 2 to 4 hours in a nebulizer form, and this is a short-term acting drug. And the second drug I'm going to go over is atropine, and this drug is an anticholinergic, and this drug is used for preventing of bronchospasm associated with chronic bronchitis or emphysema. And this drug blocks acetylcholine receptors to prevent bronchoconstriction, indirectly causes airway dilation. And some side effects will be dry mouth, throat, nasal congestion, heart palpitation, GI distress, urinary retention, increased intraocular pressure, headache, coughing, and anxiety. Nursing implications for this drug will be assessing for allergy, especially with those patients with soy or peanut allergy. We don't want to give this drug to them. We should also assess respiratory status such as lung sounds, respiratory rates before administering this drug. If wheezing occurs, withhold the medication and notify healthcare provider. Frequency of this drug is 2 puffs 4 times, 2 puffs 4 times per day. And the third drug I'm going over is inhaled corticosteroids, and this is also known as synthetic glucocorticoid. Indication for this drug is used to control inflammatory response and treat bronchospasm. And the action, this drug, corticosteroids stabilize membranes of white blood cell that release bronchoconstricting substances. Some side effects of this drug will be pharyngeal irritation, dry mouth, oral fungal infections, and systemic absorption if given in high dose. Nursing implication. So for this drug, we really want to taper down slowly when switch from systemic form to inhaled form because that will cause patient to have adrenal suppression. So we want to reduce the dosage slowly. And frequency of this drug depends on various dosages. Nursing interventions for emphysema. We want to elevate head of bed to administer low flow oxygen, usually a 1 liter to 2 liter by nasal cannula as ordered. We really want to avoid higher dosage of oxygen because it can be very dangerous. Our patient already have more than usual amount of CO2 in their system, so we don't want to give them a lot of O2 at one time. And we can also cushion the superior posterior part of their ear to prevent irritation from the nasal cannula tubing. And we want to monitor respiratory system, lung sounds, dyspnea, sputum production. And we want to assist them with nutritional intake. We want to give them high protein, high calorie diet, and also in small frequent meals, because this patient, as I mentioned before, they consume a lot of energy in breathing, not so much on eating. So we want to break these meals into small portions to support their nutritional needs. And for patient teaching, we want to advise patients to stop smoking cigarettes, because cigarette smoking is the #1 contributor to this disease. And if possible, we can let them know that nicotine replacement therapy, we can use that for minimize the effects of withdrawal. And we want to teach our patient the importance of getting influenza vaccine yearly and the pneumococcal revaccine every 5 years. And we want to teach patient that pursed lip breathing techniques, and also prevent infection and report signs and symptoms of infections, because patients of COPD are usually susceptible for a lot of pulmonary infections. And in this case specifically, that patient used the Vicks VapoRub on his nose because the irritation from the nasal cannula. We really want to emphasize on not using any petroleum products when the patients are using O2, because it can be extremely dangerous because of the possible it can be a possible fire hazard. Discharging plan for this patient, he has been discharged and on home oxygen therapy, and as nurses we can refer him to pulmonary rehab programs. For prognosis, emphysema is a irreversible disease. Irreversible condition, and it can have numerous complications like right heart failure, frequent pulmonary infection, cardiac arrhythmia, pneumonia, and pneumothorax. And this patient might have to get admitted to a long-term care facility because his wife died recently, and as his age 70, he relied a lot on his wife for his daily activities. Without his wife, he might not be able to continue on living alone. And as nurses, we should also provide the emotional support and also seek for community support. And that concludes my case study on emphysema of this patient. We went over the patient information, etiology, pathophysiology, and nursing process, and discharging planning and prognosis. Okay, thank you.